Hello. My wife and I have decided to do a few series concerning uh, applications of nursing and fighting the Morgellons. I want to deal specifically with the ears to begin with, and then we can deal with the eyes as well as the sinuses. Uh, a quick anatomy lesson. Our ears are connected down to our throat, as well as our sinuses are connected, and our mouth. And so the entities of Morgellons, if you don't know, they do migrate from the inside of our intestinal tract. They can migrate right through every cell and right on straight through our body. It's amazing. And according to some sources, they can migrate right out of the lungs up through the trachea, which you breathe through, and then up into the canal called the Eustachian Canal, which leads up to the ear. And according to some sources, scientifically, they can pass right through the tympanic membrane and come into the middle ear and outside ear. But what we found out most of the time is they come from our scalps. This is why we've already said, make sure you cut your hair off. Make sure you remove all body hair. If you're just beginning this infection, it systematically progresses. And when you get to 5, 6, 7 months, things really can get haywire if you don't fight right away. We didn't know what to do. There was so much confusion back in 2008 on the internet, and it was very difficult. So we had to shut the internet off and start our own research because of so much propaganda and confusion and probably a lot of conspiracy fed sites out there dealing with Morgellons. But we're here not to discuss that right now. We're here just to try to help you, especially those of you who are now just searching to find an answer to the madness of it. So to begin with, we start with the ears. This is your friend. This is a bobby pin. Typical bobby pin grandma probably had always in her hair. And this is, of course, a toothpick. Now, the rounded section of the bobby pin is what we use, and you can take this and gently put it into the ear and move it about and turn it a half a turn and pull it out, and you can pick up debris in your ear. And as far as Morgellons, a lot of times you'll pick up a lot of white bugs and on it, and they'll be in clusters, loads and loads of them as they try to build a nest. And what you will have to do is get them out. Now, you can get them out with using the bobby pin to a certain degree, but like I said, sometimes things really get very heavy and difficult, and so you have to take other measures as well, and we're going to share those measures with you. To begin with, you can take the bobby pin and pull some of these out and then bring it up, and you'll see just like what you're seeing right there. And we're at a point in our Morgellons that this is about the extent of our problems is with our ears and sinuses at this point. We're about 95% better than what we were. So we're thankful for that. But anyway, you take this, and then you can take this, and you can just stick the toothpick in there, and you can pull these right off. And what we do is stick them on tape. This is our best friend, is tape. We use tape for many things, and to remove these off of our skin and all sorts of things. And when things really get really bad. So you can use this if you're using a microscope. You can easily take these and stick them right onto the tape. They won't get off. And then you can put them on top of a clean slide, and then you can view them and do with them as you wish. Or you can just take them and put them directly on a slide and then do as we did hundreds of times, and using different chemicals and combinations to try to kill them, melt them down, do whatever it takes to destroy them, which is very difficult. So anyway, we got past the bobby pins and that. Now, if you have a large problem going on and your ear's stopped up and you're having trouble with hearing, which they're capable of interfering with that, you need to get yourself a flusher. You can buy it at any drugstore. Mothers know what this is. They used it on their babies to remove mucus from infants. And it's also as a flusher for the ear and whatever you want to use it for. You can actually flush with the eye if you carefully used it. But what I would do is, getting back, if you get a lot of these in the ear and you're having a problem, get yourself a jar of vapor rub. Vapor rub is something that they hate, and we found out quite by accident that in fact the vapor rub will cause a reaction in the Morgellons and even cause them to become very mushy and turn them into mush. My wife had trouble severely in her ear, and we didn't know what to do. We couldn't find anyone out there giving any nursing care of how to deal with this. And so we took it upon ourselves and went and became very aggressive. That's the key word for survival with Morgellons, is to be aggressive, because they are very aggressive, and you've got to write that across the mirror in your bathroom every day when you get up, that you will be aggressive, that you will survive. Things can get better, but perseverance and aggressiveness is what it will take. So we take this, and we take just a simple cotton ball, and you just dab this in on one side, or take your finger and rub some in here, and then take that part of it and put it in the ear, give it a half turn, and leave it. And leave it in there as long as you need to until you feel the vapor, mentholated vapor in your throat. And at that point, you can pull it out of your ear. Then you can go back in with your bobby pin gently. You don't want to shove this thing all the way deep in there. This is just to go down halfway, or whatever you need to go. You'll know, and back it out with a half turn and pull it, dragging it against the ear. You'll come out with flakes. If it's flakes, it's usually the biofilm. And if it's not the biofilm, you'll get clumps out, which could be nestlings, where the bugs are nesting and they're in a cluster. So you get those out. Now, after that canal's open and everything, and you go back in with the bobby pin and remove these things, the idea would be to turn around and get your flusher, get a tablespoon, buy yourself a bottle of 3% hydrogen peroxide. Comes in a dark brown bottle at the drugstore. You can buy it very cheap, maybe 99 cents or something. And you take it, you want to get 1 tablespoon and put it into a ceramic cup or bowl, and then take a tablespoon of water, making it a 50-50% solution. Mix it, and take an eyedropper pull up, put some in the eyedropper, turn your head over, put 3 drops in your ear, and wait 5 minutes. Let it bubble. Just be patient. Let it bubble, bubble, bubble. It'll help loosen up wax, and as well, it'll help remove any debris in your ear concerning the Morgellons. Afterwards, you'll turn your head over and just let it kind of drain out. Now, what you're going to do at this point, hopefully you'll have a partner or somebody that may help you. If not, if you're on your own, you can still do this. Get yourself another cup and put some tepid water in. Do not let it be cold or you'll find yourself dizzy, but rather don't let it get hot either, but just tepid, and fill it up with some water. Fill this up, put it in your ear, take the cup, tilt your head, and squeeze, and let it go out. Dip back into the cup, fill the bulb up again, and again. And do this 3 times. I wouldn't do it any more than 3 times because from my own experience, it can cause a problem and irritate the ear, and you'll be having to deal with working on your ears several times a day. So you don't want to flush it too many times. So flush it when it's absolutely necessary, and then give it a rest for at least 5-6 hours. But in the meantime, you can use the bobby pin and use the toothpick to help remove these entities. After you get it rinsed, the important thing is to come back with a bottle of what's called Swimmer's Ear. You can buy this in any drugstore. This is very, very important because the Morgellons do love moisture, and they will head to your ear because the ear holds moisture. It's dark, it's damp, it's everything that a bug likes. And so they will go into the ear and try to get in there. You'll find quite frequently them trying to run over the back of the ear, coming down from the scalp and then into the ear. What I do is take the Swimmer's Ear, put 3 drops in there, and dry that water up. It doesn't take long, 20 minutes or so, and the alcohol in this will mix with the water in your ear, and as the alcohol evaporates, it'll take the water out with it. Once the ear is dry, get yourself some extra olive oil and put in your ear and rub it around. Okay, we'll talk to you very shortly.